Okay, so we are going to be discussing treatment of pneumonia. The empirical treatment of pneumonia. Before we continue this video, I'd like you to like my video, share it with your friends, and subscribe to my channel. Thank you very much. Empirical treatment of pneumonia. For community-acquired pneumonia, we use the cup 65, which will give us 0 to 1. The organism responsible for community-acquired pneumonia is Streptococcus pneumoniae, Haemophilus influenza, and the antibiotic we are given is oral amoxicillin 500 mg to 1 gram 8 hourly, or oral clarithromycin 500 mg 12 hourly, or oral doxycycline 200 mg loading, then 100 mg per day for 5 days course. Is a mild pneumonia, so you use tablets. For moderate pneumonia, you would use the cup 65 if it is 2. The organism responsible: Streptococcus pneumoniae, Haemophilus influenza, Mycoplasma pneumoniae. The antibiotic to be given is oral or IV, oral amoxicillin 500 mg to 1 gram 8 hourly, plus clarithromycin 500 mg 12 hourly, or doxycycline 200 mg loading, then 100 mg 12 hourly. That is for oral doxycycline. If intravenous is required, you can give intravenous amoxicillin 500 mg 8 hourly, plus intravenous clarithromycin 500 mg 12 hourly for 7 days. So it's a 7 days course or hospital admission. Then for severe pneumonia, which the cup 65 is greater than 3, the organism is as above, which is the Streptococcus pneumoniae, Haemophilus influenza, and Mycoplasma pneumoniae. The organism to be used, the organism as mentioned, then the antibiotic. The antibiotics is co-amoxiclav 1.2 gram 8 hourly intravenously, or intravenous cefuroxime 1.5 gram 8 hourly intravenously, or intravenous clarithromycin 500 mg 12 hourly. So then you can now add your flucloxacillin. You can add your flucloxacillin plus rifampicin if Staphylococcus aureus is suspected, and treat patient for 10 days, which is, or if possible, 14 to 21 days if it is Staphylococcus aureus that is causing it, Legionella, or gram-negative enteric bacteria if they are suspected. Then for a Phantom Valentine leukocidin producing Staphylococcus aureus, you have to seek urgent help and consider adding intravenous linezolid, clindamycin, and rifampicin. For atypical organism like Legionella pneumophila, you can give fluoroquinolone plus clarithromycin or rifampicin if it is severe. If it is atypical organism like Chlamydophila species, you can give tetracycline. If it is atypical organism like Pneumocystis jirovecii in immunocompromised, you can give high-dose cotrimoxazole. Hospital-acquired pneumonia. The organism responsible for hospital-acquired is your gram-negative bacilli, Pseudomonas, anaerobes, and the antibiotic of choice is the aminoglycoside intravenously plus anti-pseudomonal penicillin V, penicillin intravenously, or third generation cephalosporin intravenously. For aspiration pneumonia, the organism responsible is Streptococcus pneumoniae, anaerobes. Antibiotics to be given is your cephalosporin intravenously plus metronidazole intravenously. Neutropenic patients, the organism which is gram-positive cocci, gram-negative bacilli are common with neutropenic patients. And the antibiotic of choice is aminoglycoside intravenously plus anti-pseudomonal penicillin intravenously or third generation cephalosporin intravenously. If fungi is suspected, you consider antifungal intravenously after 48 hours. Then pneumococcal vaccine, the at-risk group, all adults greater than or equal to 65 years, chronic heart, liver, renal or lung condition, uncontrolled diabetes mellitus, immunosuppression, e.g. asplenia, autoimmune deficiency syndrome, chemotherapy, high-dose steroid, cochlear implant, occupational risk, e.g. welders, cerebrospinal fluid leaks, vaccinate every 5 years. Contraindication: pregnancy, lactation, fever, or previous anaphylaxis to vaccine components. Thank you again. Please like and subscribe. Like my video, share to your friends. Please subscribe. Thank you so much.